I am Dr. R C Sreekumar, Founder Secretary, Vascular Society of India. At present I am based in Trivandrum, Kerala. If you look at the scenario of vascular surgery in India, it's slowly growing to be an independent specialty with around 10 centers of training for the future postgraduates or future consultants, and around 25 doctors are trained every year in this specialty. If you look at the patient load, the number of people trained and the number of people practicing the specialty are very, very less. We need more people to be trained, particularly in the newer technologies, the newer development of the specialty. Vascular surgery as a specialty was started in few centers, few major cities in India, particularly in Chennai and in Mumbai. It was started by the cardiac surgeons in Mumbai, but later more specific work started in Chennai. In the early 70s, the specialty started in Madras Medical College, one of the most popular institute in India. And later, the first full-time MCS training program started in this institution. Courses are started later in various institutes like Trivandrum Institute of Trivandrum, the SAMS Institute of Hyderabad, etc. At present, there are two types of training programs. One is a one-year training program after the MS General Surgery and 3-year full-time MCH programs in the specialty. The specialty is focused at two aspects. One is open vascular surgery and endovascular surgery. Open vascular surgery is mostly for young patients who doesn't have any other diseases, who have long-term occlusive diseases or arterial blocks. Endovascular surgery is initially meant for people with major comorbid diseases. People are not ready for or patients are not fit for any major open vascular procedures, etc. The major breakthrough in the technical development of vascular surgery comes from endovascular procedures, particularly the management of aortic aneurysms. As we all know, aneurysms is dilatation of the major arteries, which is often life-threatening due to threat of rupture. If the aneurysm ruptures, it causes massive internal hemorrhage and patient may succumb. So they need early repair. In fact, if you look at the history of aortic aneurysm surgery, it started with Rudolf Matthaus of Europe, who opened the aneurysm and put an artificial graft inside it and repaired. That is the time-proven method of managing aneurysms. Later, the endovascular technique, where some wires and catheters are placed inside the arteries and putting some stents or balloons to correct these diseases, are termed as endovascular surgery. Now it's getting popularized because it causes less mobility to the patient, it doesn't require major anesthesia, patient may be back to their normal life at the earliest. If you look at the global scenario, the most of the vascular surgery work is beginning as endovascular surgery and is very much developed, unlike India. Vascular surgery per se is a fully independent, very well-known specialty with a lot of consultants and a lot of training facilities in US or Europe or in major developed countries. One simple reason is that the most of the vascular diseases occurs in old age. As the old age increases or the life of the people, lifespan is increasing, the spectrum of vascular disease is also coming up. So to treat these old patients, the specialty is developed. In India, most of the vascular surgery problems are due to two reasons. One is diabetes mellitus and second is smoking. These are the two culprits which causes most of the vascular diseases. The diabetes mellitus and smoking can produce occlusions of arteries leading to lack of blood supply to the distal organs. The occlusions can develop in aorta or iliac arteries or any arteries in the human body, and finally the organ distal to it gets blocked or gets ischemic with no blood supply, and ultimately that organ is subjected to ulcer formations or non-performing issues, or ultimately it may become black and the patient may have to lose that part of limb. So this is corrected either by open surgery where we are putting a graft across the occlusion, usually we call them as bypass graft, or we put a stent or balloon inside the occlusive artery, get it dilated and blood flow is maintained. Another major part of the vascular surgery is treatment of varicose veins. As we all know, varicose veins is dilated serpiginous venous channels mostly seen in the lower limb. In fact, that's a prize for the human being for being a bipedal animal. Varicose veins usually causes cosmetic disfigurement of the limb, edema of the lower limb, and ulcers in the lower limb, particularly non-healing ulcers. In earlier period, we treat them by making multiple cuts in the limb, removing these dilated veins and apply stockings, and patient has to be put on bed for at least 7 to 10 days. Now, the treatment of varicose veins is changed a lot, particularly by the emergence of the vascular surgeons or vascular surgery, where we are using minimally invasive techniques like laser or radiofrequency ablation, where you put a small catheter inside the dilated veins and they get ablated either through heat energy or laser energy. The advantages are there is no cuts, so no scars, so cosmetic limb appears better or normal. The patient is mobilized the next day or same day itself, so that no clots will form inside the veins forming deep vein thrombosis, sometimes which may be fatal. So that can be completely avoided here. And also the ulcer healing, if you come with the ulcer healing also, that's better with this new techniques of laser or radiofrequency ablation. Other area where vascular surgeons contribute much is the organ transplantation, where the new organs are harvested to a particular deceased human being, affected human being. And these vessels, we are helping the transplantation. So we will help this procedure by anastomosing these vessels together. If you look at the history itself, Alexis Carrel is considered to be father of vascular surgery who performed the suturing of vessels. And Alexis Carrel has performed the first transplant in the history of human being. So he was called as father of vascular surgery, and he was one of the few doctors who was awarded Nobel Prize at that era. So that's the way vascular science also contribute to the transplant scenario. If you look at the patient load, this is one of the specialty where maximum number of patients are there. For example, if you look at a small hospital, maybe a small medical college in a suburban city, in any city in India, there may be an amputation or a removal of one part of limb. At least one case is being done per hospital, per major hospital in India. If you look at the global scenario, in every 30 seconds, that's a flash of a second, we are losing a limb somewhere in the world. So that itself shows the burden of the disease in India. Particularly, India is said to be the capital of diabetes by 2020. If you look at the diabetes effects and the arterial diseases and the varicose vein diseases, this is one of the specialty with maximum number of patient load, and these patients demanding much more than their specialty. Still, the specialty is very poorly developed in India. The most important aspect is it demands a huge technological support, and it needs a very high level skill development. Most of the procedures need long-term surgery. We need endovascular techniques in a catheterized lab we need more technologies and we need more money to save the limb and save the patient. Other challenges, of course, the lack of adequate number of trained people in the specialty. As I said earlier, there is less than 25 people are being trained per year in all over India, and still we have some states without a single vascular surgeon where nothing is being done to save the limb or save the life. The society, the Vascular Society of India, which I represent, is doing the maximum possible to get more people trained to it. So we ourselves conduct various training programs for 2 to 3 weeks or 1 month in different parts of India to bring more people into it. And also we are sending many people abroad to train the modern developments and modern technologies in the specialty, but still we have challenges. There is a study which says we need more than 5,000 vascular surgeons maybe in another 2 to 3 years, but even with all these training programs which conducted in last 15-20 years, we have less than 500 trained vascular surgeons in India, of which maybe 250 to 300 people are actively practicing in the specialty because of its challenges. If you look at the global scenario, there are more vascular surgeons available there. One thing is their technologically they have gained a lot, their financial backup is better, and they have very developed hospitals available there. Because of these reasons, if you look at developed countries, the number of vascular surgeons are adequate or near adequate. But in India, the most important challenge we face is lack of people trained in the specialty and lack of training facilities, and of course the financial need of the patient to undergo these procedures. In India, more than 80% of people are being treated from their pocket, unlike the West where they are being supported by the government or the insurance companies. So when they pay the pocket, most of the people cannot afford to do the proper treatment, and they may land up in amputations or removal of feet or foot or limb. But still have a very bright hope for the specialty because a lot of technical advances happening in the specialty. Of course, the most developments happens in endovascular scenario, where we have very much advanced stents or advanced balloons. When we are using balloons or stents, one problem with us is that dilated part may occlude in a short period or in a average period of 2 to 3 years. Now we have developed drugs attached to these balloons, usually called drug-coated balloons or drug-coated stents, which will prevent the further blockage of the blood vessels so that it will remain patent for a long time. So that's a major advancement. And we have developed various instruments which will drill into the vessels, remove the debris there, so that the block load can be reduced. And also, we are in the area of stem cell therapy, where the stem cells of the patient's own stem cells are being taken and gets cultivated and injected into the patient himself to produce new vessels. That's called neoangiogenesis. So that's a new development. And of course, the development of cloned individual organs or individual vessels also, which on the path. In the future, it may also become possible. So we have developed many newer technologies where we can make new vessels, where we can keep the new vessels patent, and where we can support the organs or build a new organ to keep the function intact. When I started my specialty, after 2-3 years of training, I thought it's a very, very difficult specialty, and I was quite pessimistic about it. I was about to meet one of the senior-most vascular surgeons of India, and I asked a question to him: what's the future of the specialty, and what's the future of me if I pursue to the specialty? Then he said, this is one of the most beautiful specialty. Of course, it's challenges, but it's one specialty where you can contribute very much to the patient and see, and our patient load is much more than many other countries and many other specialities in India itself. We need more people in the specialty, and we need more technology support, and we need some financial support from government and various organizations. Then we can do a wonderful future. We can have a wonderful future in the specialty, and we can do wonderful support to the humanity. Vascular Society of India is an organization started in Chennai in the 80s to promote the specialty in India, to promote the awareness of vascular disease in India, and to promote training of surgeons and other people who is involving the treatment of vascular disease in India. Now, society has spread all over India with representation in most of the states, have more than 500 members into it. And we conduct monthly training programs in most of the states, conduct 2 annual meetings. One is exclusively for the training of the postgraduates in the specialty, and one is an annual conference where we bring more than 100 faculties from all over the world to exchange the developments happening in the specialty from different societies. We as a society is associated with most of the international societies, and we are a part of many activities undergoing in different parts of the world, like American Society or European Society, etc., etc. So we are part of it, and we are always actively involved in the academic discussions which is happening there to share the scenario of disease in India and to accept the better treatment modalities which we can offer from there to our patients. Also, we send around 20 doctors, mostly the training surgeons, to different parts of the world, including the conferences, where they can identify or they can learn the newer developments in the specialty, and they can impart the better training modalities in India.